But there are several things that strike me about this 2 hours that we spent here. First of all, and maybe three things. I'm impressed with the degree or the understanding of the problem, both the nature and the scope of the problem that exists in this room. That's pretty unusual around the state of Ohio. I'm impressed with the fact that your treatment and community, CADA and the board have tackled and overcome some very serious biases around effective interventions. That's also unusual. And then I think the third thing is there's important work going on here. So those three things together really make Ashland a somewhat unique community in our state. There are a number of communities more seriously affected by opiate addiction that really struggle with the notion of medication-assisted treatment. Back in Fairfield County, I thought that we were one of the first boards to adopt medication-assisted treatment to deal with opiate addiction. We started in 2006. Dennis started in 2004. So this is a very forward-thinking treatment system, and the degree of integration that exists between the treatment community and law enforcement and your judicial system is really quite impressive. Would like to just punctuate a few things before I close. Dennis did a very nice job addressing the increase in dosing and the relationship that exists between the increase in dosing over time and overdose deaths. I want to punctuate that because it's really important. If you go back to 2001 and you looked at the amount of doses that were being dispensed in our state, we believe it was maybe 6 or 7 opioid doses per person. Now, if you flash forward to 2010, every one of us, if you took the total number of doses and divided it by our state's population, every single human being in our state would receive 67 doses of opioids. Now, if you convert that to Vicodin, which is the most commonly used opioid in our healthcare system, every single one of us would have received 100 doses of Vicodin. Here in the United States, we use about 60% of all of the opioids produced in the world. We have about 4.5% of the world's population. That includes 99% of the world's supply of hydrocodone, which is Vicodin, and about 80% of the world's supply of oxycodone. It's completely absurd. So when you look at the nature of a problem, you look at cause and then you look at effect. The cause here, from my perspective, the main cause is the dramatic escalation in the use of prescription opioid medications in our healthcare system. One of the things that really makes me sad is that several years ago, when we first started to talk about opiate addiction and heroin addiction in our state, everybody was shocked. You know what? People aren't shocked anymore. This is becoming a routine topic. People aren't surprised. And that's very troubling to me, that we are beginning to accept a degree of carnage in our state that has historically not been a part of our environment. So I think we have a tremendous amount of work to do, but I also think that there is important work that is underway here in Ashland. I'm really proud, Steve, of what you and Dennis have accomplished, and in the degree of collective work that is going on with your colleagues in the judicial and criminal justice systems. This is a really impressive event, and I appreciate the opportunity to contribute. Thank you.